So after you have your baby in an out-of-hospital setting, our last things that we have to go over are postpartum instructions. So these are the basic postpartum instructions. Of course, they would be adapted to each parent's situation and what their needs are after their birth, depending on how that was. But this is the general run-of-the-mill things to look for mom and baby. Hold on a minute. Back. Okay, so for mom, temperature should be between 96 and 99 degrees. 100.4 is considered a fever. And that's something worth calling about. On these postpartum instructions, there's going to be specific areas that are going to tell you this is when to call, this is what's normal, so you know the difference. The pulse shouldn't be over 100 beats per minute. That's considered tachycardia and can indicate some complications. That's something we would want to know about as well. If you're bleeding through like a heavy pad, most people have heavy pads or adult diapers that they wear after a birth. If you're soaking through one of those in an hour, we want to know about it. Also, if you're bleeding, we want you to feel for your uterus. You're going to feel at your belly button and push down until you can feel like a grapefruit sized form, and that's your uterus. If you're bleeding a lot, you're going to want to feel for that, and if you don't feel anything, you want to rub there. It's going to be sensitive, and it will firm up and contract. If you continue to bleed after rubbing and you don't feel a grapefruit in there, that's another thing I want you to call about. So any sort of a fever, if you've got a really rapid pulse, if your uterus is soft and you can't get it to firm up with massage, if you're soaking through a large pad in an hour or a diaper, passing any tissue or clots that are bigger than a lime, I want to know about it. If there's any foul discharge, you'll know the difference between just like what your natural blood smells like and what smelly stuff smells like. Want to know about that. Also, we watch for preeclampsia symptoms in postpartum. Those would be signs of upper abdominal pain, fainting, spotted vision, high blood pressure. You can check your blood pressure at home if you wish to keep an eye on that, especially if you have concerns. We're also going to want to know about any headaches. Especially severe headaches. You may have headaches after birth just from losing blood and from exhaustion, being tired, being dehydrated possibly. But once again, you'll know the difference between like a normal headache, a dehydration headache, and a really severe headache. Also, any leg pain or chest pain could be signs of a blood clot. So we want to know about that. Any pain or tenderness in the legs or the chest. And then again, we want to know how you're coping, because baby blues can happen. Postpartum depression can set in. So if you're feeling unstable emotions, feelings of despair, inability to cope with the baby, taking care of yourself, we want to know about that so we know how to help better. When it comes to baby, their temperature should be between 96 and 99 as well, and breaths somewhere between 30 and 60 a minute. You can feel for their breaths by putting a hand on their back or their chest and feeling for that rise and fall, and just watching the clock for an entire minute. The baby's breathing rhythms are really sporadic in the first few days as they're learning how to breathe outside of the water. So they might have a few like really quick breaths, like and then nothing for a few seconds, and that's okay, and that's normal. So that's why you're gonna want to count for an entire minute. The heart rate's gonna be between 110 and 160. That's harder to calculate unless you have a stethoscope. You're going to watch for your baby's breathing and see that they're not flaring their nostrils. That represents struggling to get air in and breathing correctly. You're also going to watch their tummy and their ribs and see what they do. If their ribs are like flaring outward, if their chest looks kind of like a barrel and really full, that's not normal. Those are signs that your baby's struggling to breathe. So that's something that we would want to know about. The baby should be having a bowel movement and urinating daily after birth. So if your baby came out, a lot of babies come out and they have a poop immediately, that counts as your baby's poop for the day. So you can expect one poop and one pee for however days old your baby is, up until 7 days. So an example of that is your baby is 4 days old. You would expect about 4 poops a day and 4 pees. And then your baby's just going to be pooping and peeing all the time. You're going to be using all the diapers. So we want to know if your baby is not pooping in the first 24 hours or beyond. We'll talk about this at your 24 to 48 hour home visit as well. And then the baby should be feeding every 2 to 3 hours for like 20 minutes on each side. If they can. There's no rules, but we want them latched for a good while so that they're getting enough. And all they need is that colostrum in the early days. Their stomach starts out super tiny like a marble, so don't worry about the baby not getting enough because their tummy is tiny. It will stretch as your milk comes in, and then what you have is sufficient for your baby in the beginning. And then it's recommended that baby sleeps on their back in a space that is not in your bed. Some parents choose to roll up a swaddle and place baby on their side. If baby had a hard time, maybe aspirated some fluid while coming out, that can be a good idea to help drain that fluid. You can always do that not at nighttime and just while the baby's napping and you're watching them while they sleep on their side. So you're going to want to call the midwife if baby is breathing really quick or really slow. If they have a fever over 100.4, sorry. If there's no poops or pees in the first day after birth. If your baby's really tired and you can't wake them up to feed, we want to know about that. And then if your baby gets yellow at all, that's a sign of jaundice. And we worry about that most in the first 24 hours after birth. So if baby's getting yellow, we want to hear about it. It's going to start from the top of their head and work its way down. So you usually notice it at the forehead first or in the whites of the baby's eyes. And then if you chose to decline vitamin K for your baby, you're going to want to watch for any sort of bruising or bleeding or pale color. Those can be signs of hemorrhagic disease of the newborn. If your baby had any bruises with birth or any sort of injury, you'll want to keep an eye on those and make sure that those aren't changing too much. So then that kind of finishes up what we have on the script, and then I would ask parents for any questions and see how I can best answer them and encourage them to call for any reason if they have any concern. It's better to get that cleared up than to wonder.